The crazy reasons why there still isn't a male contraceptive pill. Hi, I'm Dr. Nagat and the author of The Knowledge, Your Guide to Female Health from Menstruation to the Menopause. And in this book, I've covered extensively all the risks and benefits and the side effects of female hormone contraceptive, as well as all the male contraceptives options out there. And can I just say, the male contraceptive bit was a tiny bit of my book, and I'm going to tell you why. So whilst Elon Musk was highlighting the side effects of female hormone contraceptives, which every woman taking them already knew about, and we as doctors know about, and so it came as no surprise, I was thinking maybe he could share why there is no male contraceptive. Anyway, I won't hold my breath. So here are the three main reasons why we don't have a male contraceptive pill on the market yet. Reason number one, lack of funding. Yep, after decades of work, researchers discovered the blood pressure medication phenoxybenzamine had an ejaculation suppressing effect. It was even dubbed the clean sheet pill, i.e. there's no ejaculation. It was thought that a safe and effective male pill could have the potential to finally unburden women of the responsibility of contraception and prevent millions of unwanted pregnancies every year. However, some men found the idea of an invisible orgasm distinctly unappealing. For a proportion of men, the so-called clean sheets pill was seen as emasculating. The method eventually lost its funding, and the researchers went back to the drawing board. Reason number two, forgive me if my bias as a woman who has taken the pill and I prescribe the pill to my patients gets in the way of how much empathy I have with this one. I'll try and be impartial, but the double standards are just so maddening. Anyway, reason number two, the side effects of the male contraceptive pill, such as headaches, nausea, abdominal cramps, and acne, were just not tolerated by the male participants. The male contraceptive pills are held to a higher set of standards than when the female contraceptive pills were trialed in about the 1950s. So in terms of acceptable side effects, safety, and the actual need for a male pill is deemed not necessary because, well, to state the medically obvious, biological men can't get pregnant. So again, the trials were stopped. This is also because the Declaration of Helsinki, which is a code of medical ethics designed to protect participants in medical research, it stipulates that scientists should put trial participants first and consider whether the potential benefits to those individuals weigh the risk on causing harm. And because biological men cannot get pregnant, why put them at harm? And that's why the trials keep stopping. Although biological women in the original pill trial had no such safeguards. There were just 1,500 women involved in the trial, and though half of the participants dropped out, and get this, 3 died, the trials were not stopped, and the drugs were still approved by the FDA in 1960. I mean, the double standards here are crazy. And how are still women fobbed off when they talk about side effects with their contraceptive pill, but also the benefits that they get and the fact that we are constantly regenerating when men, because they had headaches and felt nauseous, the trials keep getting stopped because they can't cope with the side effects. Whereas the original trial, women, literally 3 women died in the trial. And they didn't stop it, and they just still carried on. And we are where we are with the female contraceptive pill. Reason number 3, cultural acceptance of male responsibility in an unplanned pregnancy. Yeah, culturally, although we know it takes 2 people to have an unplanned pregnancy, it's still the woman at fault who did not protect herself. So there is a path to acceptance we need to tackle. So researchers moved to a number of non-hormonal contraceptive options for men, including a vaccine that targets a protein involved in sperm development and a kind of a temporary vasectomy, which is reversible inhibition of sperm under guidance, which involves injecting a synthetic polymer into the tube that carries sperm out of the testes, the vas deferens, so here to block the exhale of sperm. It's currently undergoing phase 3 clinical trials, the final stage of testing before a treatment is approved in India. The other promising non-hormonal trial is a protein that temporarily immobilizes sperm in mice, but it's not past the lab animal testing phase yet, and funding might get pulled. You have to ask yourself, do men want a male contraceptive to unburden their partners from the responsibility of family planning? And would women trust them to take the pill. Now, I came across this really interesting article which showed around the globe what the opinions are of people, and you'll find this fascinating. So this infographic explains it really well. Will men use contraception? And the number of men that said that they would, 81% said that they would take the male contraceptive pill. Would women trust them? The number of women that said they would trust their partner globally to take the pill, only 66%. But also they broke this infographic up into what's happening around the globe. So in Netherlands, 54% of men said that they would try the male contraceptive pill, but 88% of women said that they would like their partner to do it. And this was really fascinating, actually. In Uganda, 95% of men and 77% of women said that they would like the idea of having some form of hormonal or male contraceptive pill being available. I suppose this isn't a question of a battle of the sexes, men v women, about who takes what sort of hormonal contraceptive or non-hormonal contraceptive methods. I think this for me is the fact that we should be breaking down the taboo and stigma that it's not just the woman's responsibility if an unplanned pregnancy happens, especially with Roe versus Wade being overturned. This is a conversation that ultimately we should be having. How can men ultimately be active participants in family planning and help with unwanted pregnancies and take the burden of responsibility off women who take so much contraception as it is? Leave your comments down below, and I'd love to hear your thoughts on this.